Welcome back to the Anti-Cancer Lab. If you're new here, pull up a chair, you're in good company. This is where I read the cancer studies most people never see and tell you, plainly, what they actually mean for you. No fear, no hype. So grab a coffee and let's look at this one together, because today is a detection video, not a food video. And it's about a cancer that hides better than almost any other, in a place you can't see, giving off signals so quiet that most people, and honestly a lot of doctors in a rushed visit, walk right past them. So let me tell you exactly what you're going to get out of the next 20 minutes, so you know it's worth staying. I'm going to walk you through the quiet signs of colon cancer, the ones that can flicker in the year or two before a diagnosis, the changes in the bathroom people are too embarrassed to mention, and the big one, the single number on an ordinary blood test that, when it's low, should make a doctor turn around and look at your colon, and instead gets shrugged off as just getting older. I'll show you what's normal versus what's worth a check, and then, most important of all, the two things you can actually get done to catch this early. Because with colon cancer, that part matters more than any symptom I'll name. Quick note before we go one step further. I'm Dr. Becker. I'm a researcher, not your doctor, and I've never had cancer or treated a single patient. Everything I'm about to say is me translating published studies for general education. None of it is medical advice, and none of it is a diagnosis. If something here worries you, the answer is never a video. The answer is your own doctor. I'm going to repeat that a lot today, and I mean it every single time. Now let me put my honest opinion on the table before I teach you a thing, because it's the whole reason I made this one. Of all the cancers I read about, colon cancer frustrates me the most. Not because it's the deadliest, but because it is one of the most catchable, and we still catch too much of it too late. This is a cancer we can literally find and remove before it's even a cancer, while it's still just a harmless little growth. And yet people put off the one test that does that and explain away the early signals for months, because the signals are humble and private and easy to blame on age or on something you ate. I find that maddening, in the gentlest way, because it doesn't have to be like that. So today isn't a scare, it's the opposite. It's me trying to hand you the 2 or 3 things that tip the odds hard in your favor. Let me start with a person, because that's where this really lives for me. I sat with a woman a while back, I'll call her Mabel, 66, and she came to me tired, just tired, in a bone-deep way that a good night's sleep never touched. She'd gone a little pale, and climbing her own stairs left her winded in a way that was new. And she told me with a shrug, "Well, that's just getting older, isn't it?" Her doctor had run some blood work months before and mentioned, in passing, that her iron was a bit low and suggested she take a supplement. And that was it. Nobody asked the next question. Nobody said the word that should follow low iron in a woman her age, like a shadow follows a person. Hold on to Mabel, because she's the heart of this whole video, and I'll come back to her. Let me set the stage with one honest truth about how this cancer grows, because it changes everything about how you think about the signs. Colon cancer, most of the time, does not appear overnight. It usually starts as a tiny growth on the inner wall of the colon, called a polyp, a small, fleshy bump, and the vast majority of them are completely harmless and will never do a thing. But a certain kind of polyp can, very slowly, over years, turn into a cancer. And when I say slowly, I mean it. The research on this, what's called the adenoma to carcinoma sequence, suggests that on average, it takes something like 10 years, sometimes 10 to 15, for one of those growths to become a cancer. Now sit with what that means for our title. If the whole process takes 10 years, then 2 years before a diagnosis, the signs are often faint or intermittent or honestly not there at all yet. That is not me undercutting the video. It's the single most important thing I can teach you today. It means waiting for a symptom is the wrong game to play with this particular cancer. The real win isn't spotting a sign 2 years out. It's finding and snipping out that harmless little polyp during those 10 quiet years, before it ever becomes anything, before there's a single symptom to notice. Keep that in your pocket. It's the reframe the whole thing turns on. So, here's how I'll do this. First, I'll give you the signs, the real ones the research recognizes, so that if they ever show up, you don't wave them off. And then I'll give you the part that matters even more than the signs. The two things that catch this thing before the signs ever start. Alright, let's go. The first sign is the one from the story, the one nobody checks, and if you take one thing from this whole video, I'd love it to be this. It's iron deficiency anemia. Now, let me translate that out of doctor speak in the same breath, because the words hide the meaning. Anemia just means you're low on healthy red blood cells, the cells that carry oxygen around your body. Iron deficiency anemia means the reason you're low is that you've run short on iron, the mineral your body needs to build those cells. And what does that actually feel like day to day? It feels like Mabel, a tiredness that sleep won't fix. Skin gone a little pale, especially in the lips and the inside of the eyelids. Getting winded, short of breath, from things that never used to wind you, like a flight of stairs or carrying the groceries in, maybe a strange racing of the heart. People blame every bit of that on age, every single time. Now, here is the part that connects it to the colon, and it's beautifully simple once you see it. A growth on the wall of the colon is fragile, and it can bleed, but very slowly, a tiny amount at a time, so slowly that the blood is invisible, completely undetectable to your eye in the toilet. You would never, ever see it, but drip by drip, day after day, that slow, invisible bleed drains your iron stores dry, and so the cancer doesn't announce itself with blood you can see. It announces itself, quietly, as low iron on a blood test, and as the tiredness and the pallor and the breathlessness that come with it. The bleeding is silent. The anemia is the echo of it. Now, this is exactly where I need to slow you down, hard, because I do not want to frighten the enormous number of people who have low iron for reasons that have nothing to do with cancer. Let me say that more carefully. Iron deficiency anemia is common, and most of the time it is not cancer, not remotely. In younger women, it's very often just monthly blood loss. It can come from your diet, from certain medications like the everyday pain relievers that irritate the stomach, from other conditions entirely. So low iron by itself is not a diagnosis. But, and this is the whole point, in certain people, it is a genuine red flag that the guidelines take very seriously. And those people are men of any adult age and women past menopause. Here's the logic, and it's clean. A man or a woman who's no longer having periods has no ordinary monthly reason to be losing blood. So when they turn up with unexplained iron deficiency anemia, the medical societies, the gastroenterology guidance in Britain, the guidance here, to say that a slow bleed from somewhere in the gut has to be ruled out, and the colon is at the top of that list. In fact, the research calls iron deficiency anemia the single most common sign that shows up outside the bowel itself in people who turn out to have colon cancer. So the normal versus worth a check line here is simple. Low iron with an obvious explanation in a younger woman, addressed and followed. That's routine. Unexplained low iron in a man, or in a woman past the change of life with nobody chasing down why. That is the one I would never let go unanswered. And that leads me straight to what to ask for, because this is where Mabel's story so often goes wrong. When a doctor says your iron is a little low, the reflex, the busy 12-minute reflex, is to hand you a supplement and move on. And a supplement will raise your iron. But it does absolutely nothing to answer the question of why it dropped in the first place. Here's my honest read of what I'd want for myself. If I were a man, or a postmenopausal woman, and my iron came back unexplained low, I would not just accept the pills and leave. I would ask, out loud, one question. I'd say, my iron is low, and we don't know why. Given my age, should we be looking at my colon to make sure nothing's bleeding down there? That one sentence turns a shrug into an investigation. It's the sentence nobody said for Mabel for months. Don't just take the iron. Ask why the iron is low. All right. The second sign is a change in your bathroom habits. And I'll be plain and gentle about it because people clam up here, and I wish they wouldn't. What we're watching for is a genuine, persistent change from your own normal. New looseness or diarrhea that hangs around for weeks and won't settle. Or the opposite, a new constipation that isn't like you. And you may have heard about stools getting narrower, thinner, ribbon-like, or pencil-thin. Let me give you the honest research picture on that one, because it's more nuanced than the internet makes it. Thin stools all by themselves, in isolation, are actually not a reliable sign of colon cancer at all. Plenty of harmless things narrow the stool, and studies have specifically pushed back on the idea that pencil-thin stool on its own means cancer. So please don't lie awake over the shape of one bowel movement. The reason narrowing gets mentioned at all is the mechanism, which is easy to picture. If there's a growth low down in the colon, near the exit, it can act like a partial narrowing in a pipe, and what squeezes past it comes out thinner. So it's only worth attention as a new, lasting change that arrives alongside the other signs on this list, not as a thing to panic about on its own. The honest version is this: one odd trip to the bathroom means nothing. A new pattern in how your bowels behave that is clearly different from your normal and lasts for several weeks and doesn't drift back. That's the one you mentioned to a doctor, not tonight's upset stomach, the change that stays. The third sign is the one people do notice but often talk themselves out of, and it's blood you can actually see. Now, unlike that invisible slow bleed we talked about, this is visible blood in or on the stool, and there's a detail here genuinely worth knowing, because the color carries a clue about where it's coming from. Bright red blood, the kind you see streaked on the stool or in the bowl or on the paper, usually means the bleeding is low down and close to the exit, the rectum, or the lower left part of the colon. That's the same neighborhood where a lot of colon and rectal cancers sit, though it's also, and far more commonly, exactly where hemorrhoids and little tears live. Then there's the other kind, dark blood, or a black, tarry, sticky stool that almost looks like tar and has a distinct foul smell. Doctors call that melena. That darker picture usually means the blood has traveled a longer distance and been broken down along the way, which points higher up, often the stomach or upper gut, but it can also come from a bleed on the right, far side of the colon. Here's my careful hedge, and it matters. The most common cause of bright red blood by far is hemorrhoids, which are harmless and miserable and incredibly ordinary. Most rectal bleeding is not cancer, but here's the trap I want you out of. You cannot tell the difference by looking. You cannot. Hemorrhoids and a tumor can produce the very same streak of red, and the deadly mistake, the one I'd beg you not to make, is deciding on your own that it's just the hemorrhoids again and never getting it checked. So the rule is clean. Any new blood in the stool, bright or dark, gets mentioned to a doctor once, so a professional can find where it's coming from. Bright is not a green light. Dark, black, tarry blood is a cold promptly situation. Neither one is yours to diagnose from the bathroom. The fourth sign is unexplained weight loss along with a low, persistent discomfort in the belly, and I want to be precise about that word unexplained, the same way I always am. If you're walking more or eating less on purpose, that's explained and good for you. What we watch for is the weight that leaves when you're doing nothing to lose it. The trousers going loose while you eat exactly as you always have. And the discomfort we mean isn't a sharp, dramatic pain. It's often a vague, low, crampy fullness, a bloating, a sense that things aren't moving right, that just lingers. Why would the colon cause either? The weight loss. Because a cancer anywhere in the body can quietly raise your metabolism and dim your appetite, spending your reserves without asking. And the discomfort, because a growth can partly obstruct the flow through the colon, causing cramping and gas that backs up behind it. Now the caveat, and please hear it fully, both have a long, mostly harmless or treatable list of causes. A thyroid running hot, a change in medication, stress, irritable bowel, a dozen ordinary things. This is the vaguest cluster on the list, which is exactly why it slips by. But losing weight without trying, past a few pounds, that persists. That always earns a conversation with a doctor. Always. It's your body spending money you didn't authorize, and you're allowed to ask where it's going. Now, let me pause and do the thing this channel exists to do, which is be honest with you even when it costs the drama. Because I've just handed you 5 signs, and I know precisely what some of you are doing this very second. You're going down the list. Tired? Yes. Bit pale? Maybe. My stomach's been off. My back? I saw a streak last week. I know, because I would do the exact same thing, so let me be as straight as I can be. Having one of these, even 2, on an ordinary month means almost nothing. Every single sign I named is far more likely to be something completely benign. And remember the honest truth we started with. 2 years before a diagnosis, these signs are often faint or simply absent because the thing grows so slowly. So if you're sitting there without a single symptom, please do not read that as safety. That's the cruel twist of this cancer, and it's why I have to give you the next part, because the next part is the part that actually saves lives, and it has nothing to do with waiting for a sign at all. Here it is, the real lever, the thing I'd tattoo on the inside of my own eyelids if I could. With colon cancer, screening beats symptom watching, and it isn't close. Because we can find and remove the growth during those 10 silent years, this is one of the very few cancers you can genuinely head off before it ever becomes one. So let me give you the 2 tools people skip plainly, and then how to actually use them. The first tool is the humble one, and it's the one that lives in a drawer. It's the at-home stool test, the FIT test. That stands for Fecal Immunochemical Test, and all it does is check your stool for those tiny invisible traces of blood, the same silent bleed we talked about with Mabel's iron. You do it at home, privately, no prep, no fuss, and you mail it in. Let me be honest about what it can and can't do, because I promised you honesty. The fit is good, not perfect. In the research, it catches roughly 70 to 80%, sometimes more, of actual colon cancers, and it's quite specific, meaning a clean result is genuinely reassuring most of the time. But it misses a meaningful share of early cancers and a lot of those precancerous polyps, because a polyp that isn't bleeding that day leaves no trace to find. That's the catch. So, a FIT test is a wonderful, cheap, easy net, but it's a net with some holes, which is exactly why it's designed to be done every single year, not once. One clear fit is good news for now. It is not a permanent all clear. And here's the tool people skip inside the tool. A huge number of folks are handed a fit kit, mean to do it, and it sits in the bathroom drawer for a year unopened. I sat with a man, call him Roland, 68, who did exactly that. Kit in the drawer, kept meaning to, life got busy, a year went by. The test that could have caught something early was 3 feet away the whole time, in a drawer. Don't be Roland's drawer. The test only works when it leaves the drawer and goes in the mail. The second tool is the thorough one, the colonoscopy, and I know nobody's excited about it, so let me reframe it honestly. This is the one where a doctor actually looks at the hole inside of the colon with a camera, and here is the magic of it the fit can't do. If they find one of those little polyps while they're in there, they can remove it right then, in the same appointment, before it ever has the chance to turn into anything. Read that again. It is not just a detection test. It is a prevention procedure. It finds and removes the future cancer in one motion. Yes, there's a prep the day before that people grumble about, and it's genuinely the worst part, and it's one unpleasant evening. And because it's so thorough, if it's clean, you typically don't need another for around 10 years, which is no coincidence. It's built around that 10-year growth window. One good look buys you a decade. So which do you do? That's a conversation for you and your doctor, not a decree from me, and both are legitimate, respected options. Some people do the easy home fit every year and only move to a colonoscopy if it flags something. Some go straight to the colonoscopy for the peace of mind and the 10-year gap. The wrong choice, the only wrong choice, is doing neither. And that brings me to the number that anchors all of this, the one I want you to actually write down. The screening age. The guidance in the United States now says start colon cancer screening at 45 for people at average risk. It used to be 50, and they lowered it deliberately because colon cancer has been rising in younger adults, in people in their 40s and even 30s, at a genuinely startling rate over the last couple of decades. So if you are 45 or older and you have never been screened, you are, right now, overdue. And that's true, even if you feel perfectly fine. Especially if you feel perfectly fine, because feeling fine is exactly what this cancer counts on. And if colon cancer runs in your family, the age to start is often earlier, which again is a your doctor conversation, not mine. Now, let me be as straight with you as I know how to be. The honest limit of what I do here. I read the studies. I can't examine you. I can't run your blood, or scope your colon, or tell you what a symptom means from behind a screen, and neither can any video, and I gently ask you to be suspicious of anyone online who claims they can. There is no food in this video that prevents colon cancer, no supplement that catches it, and I'm not going to pretend there is. The things that actually catch this are the two dull, unglamorous tools I just described, ordered and read by a real person who's looking at the real you. That's not the disappointing answer. In this case, it's the hopeful one, because those tools work, and they're within reach, and they can stop this thing before it starts. So here is your one thing this week, and pick whichever one fits you. If you're 45 or older and you have never been screened, this is your week. Book it, or at the very least make the phone call and put the appointment on the calendar. If you've got a fit kit in a drawer somewhere, be honest, go get it, do it this weekend, and put it in the mail on Monday. Don't be the drawer. And if you've had blood work recently that showed low iron and nobody ever explained why, especially if you're a man or a woman past menopause, call and ask the one sentence. My iron was low, and we never found out why. Given my age, should we be looking at my colon? Any one of those three, done this week, is a real move. Not a worry, a move. You don't hold the whole outcome of this in your hands, and I won't pretend you do. But with this particular cancer, you hold more of it than with almost any other. And that's the truth I want you to leave with. You can be checked before there's ever a sign. You can have the growth removed before it's ever a cancer. That is a real, powerful lever, and it's sitting right there for you to pull. Use it, bring it to the people caring for you, and let them do the rest. Mabel got her answer, eventually. Once somebody finally asked why her iron was low. And whatever the news is at the end of a phone call like that, the person who called early always gave themselves the better version of the story. Keep it simple. Get yourself checked, and I'll see you right back here. Bring a friend who's been putting this one off. This is one of those you send to somebody you love who's 45 or older and keep saying next year. And tell me in the comments, have you had your screening yet? And if not, what's the thing that's been stopping you? I read every one of these, and sometimes just saying it out loud is what finally gets it on the calendar.